Augmented reality, or AR, is an interactive experience that combines the real world and computer-generated content. You might wonder how it's related to healthcare. Actually, this groundbreaking technology is changing the way we learn, plan, and execute medical procedures, making healthcare more accessible, precise, and interactive. From professionals to patients or students, AR is reshaping every facet of healthcare. To show a better understanding of how it works and benefits, let's embark on these three scenarios, which are AR in education, AR in surgery, and AR in physical therapy. And in each case, there will be two conditions, one involving the presence of AR technology and the other without.
Since its inception, augmented reality has seen great potential in the field of education, including the training of medical students and practitioners. One such student whose journey we will follow. With lessons commonly delivered through AR headsets, like the commercially available Microsoft HoloLens, the versatility of AR allows it to cover a wide suite of clinical topics in class. Among the most common is the field of real-time anatomy analysis in 3D through realistic holographic anatomy models. Applications such as the HoloAnatomy software suite developed by the Case Western Reserve University provide a validated and tested medical curriculum, advertising on-demand access to 3D human anatomy via virtual cadavers. These holographic models, projected directly into the teaching environment, can be interacted with and manipulated in every dimension, allowing students to virtually explore human anatomy at will from all angles, often achieving perspectives and views that are impossible to perform in reality. AR-conducted anatomical lessons are able to provide students with practical and immersive visual learning experiences, while also providing a buffer against student error, as a real cadaver or patient is not required. Additionally, other clinical applications make use of AR to provide immersive teaching, such as the Holo Patient module developed by GigXR. The model features 3D projected training scenarios to coach students in patient diagnosis, using the scripted performances of real human actors portraying differing medical conditions. AR allows for these scenarios to be taught on demand, training students in patient empathy without the constant need for hiring real actors. And this only scratches the surface. The potential of AR applications in medical training are limitless, and have only grown with the forced advent of remote learning due to the COVID-19 pandemic.
Let's have a look how the surgery works without and with AR glasses.
As a patient is prepped for surgery, let's delve into the transformative impact of augmented reality in the operation room. The traditional approach may not accommodate and adapt for differences in individuals, which leads to large incisions, longer uptimes, and higher rates of inaccuracy. The surgeon equipped with AR technology can navigate complex anatomical landscapes with confidence, making informed decisions on the fly. AR systems overlay virtual information onto the real world, providing surgeons with valuable insights during procedures. This allows them to create and interact with detailed 3D models of a patient's anatomy, enabling thorough pre-operative planning. The typical AR system integrates various sensors, including cameras, infrared receptors, wireless sensors, all into one simple device to provide surgeons with data of high quality and low latency. During surgery, AR provides real-time navigation, displaying critical information like blood vessels, nerves, bone structures, and tumor boundaries directly onto the surgeon's field of view. Minimally invasive procedures become even more precise with AR, reducing the risk of complications and shortening recovery times. At the same time, medical education is transformed as students and doctors immerse themselves in AR-assisted surgical simulations, gaining deeper insights and ensuring the procedure is carried out efficiently. AR also allows surgeons to explain complex procedures to patients using interactive visualizations, ensuring better patient understanding and informed decision-making. As technology evolves, we can anticipate even more advanced AR applications, such as real-time tissue analysis, AI-guided procedures, and personalized treatment plans.
Here are some aspects we should not overlook when utilizing AR techniques in surgery. The application of AR in surgery introduces a new layer of complexity that demands careful consideration. From the cost aspect, AR devices, software development, training programs, and ongoing maintenance can lead to high costs for healthcare institutions. From the perspective of the learning curve, surgeons and medical professionals might encounter a steep learning curve when adopting AR technology. Acquiring the essential skills to use AR systems effectively can be time-consuming and demanding, potentially impacting surgical performance. From the perspective of data privacy, AR systems require access to patient data, including medical histories and imaging scans, to provide real-time information during surgeries. Nevertheless, the collection, storage, and transmission of sensitive patient information raise concerns regarding data privacy and security. From an accessibility perspective, surgeons might encounter challenges related to device availability, comfort, and compatibility with existing surgical practices. Those who are not familiar with the technology could face difficulties in adapting to it, potentially affecting their surgical performance and patient outcomes. Additionally, AR devices such as headsets or smart glasses might not have been designed with the specific physical demands of surgical settings in mind. In terms of the error rate, while AR technology promises enhanced visualization and accuracy, it also introduces the potential for errors. Technical glitches, inaccurate data overlays, or misinterpretation of AR-generated information could result in surgical mistakes. Therefore, ensuring collaboration between medical professionals, software developers, and engineers is crucial. Establishing regular feedback loops and implementing iterative improvements to AR systems can effectively address and mitigate potential vulnerabilities over time.
Augmented reality is not only useful for surgeons and other clinical professionals, but patients too. AR in physical therapy is a promising field of research, with many studies showing that it can be used to improve outcomes in patients dealing with Parkinson's disease, stroke recovery, cardiovascular disease, and more. Consider the case of upper limb amputation. A key concern with recovery following such a procedure is that it is vital for patients to consistently and properly perform the prescribed physiotherapy in order to prepare limbs for a prosthesis. However, patients are typically made to practice on their own with minimal feedback regarding just how effective the exercises are, which can be pretty demotivating. AR can help here by providing objective feedback through various sensors that patients can rely on to understand exactly how they are progressing with their exercises. For example, a sensor attached to the patient's limb can track its movement and the activation of the underlying nerves. This data would be converted into a digital hand moving through space and making the required gestures, all projected to the patient's vision via an AR-mounted headset. AR can also make the rehabilitation process fun and motivating through gamification, leading to increased patient compliance. The result is effective physiotherapy and a happy patient.
In conclusion, the future of AR applications applied to the field of healthcare holds incredible promise for the future. In surgical practice, AR has led to enhanced precision, reduced operative times, and improved patient safety outcomes. In healthcare education, AR has created immersive educational experiences for doctors in training, thereby shortening learning curves. In physical therapy, AR has elevated patient engagement, yielding superior outcomes to treatments without it. In conclusion, the future of AR applications applied to the field of healthcare holds incredible promise for the future and has added new dimensions